Thanks, Travis. Well, October is Breast Cancer Awareness Month, and while much of the emphasis is put on preventing cancer, this morning we're looking at what happens after a woman is diagnosed, particularly the options for reconstructive surgery after having the breasts removed. Now, joining us now is Dr. Cho, a board-certified plastic and reconstructive surgeon right here in Houston. And good morning. We thank you so much for joining us.
Good morning, and thank you for having me.
Well, obviously, after a woman has gone through something like this, they're dealing with, physical, emotional pain, but then moving forward, they're going to want to make some changes and think about reconstructive surgery. So after a mastectomy or lumpectomy, what are some things they should be thinking about?
That's a great question. Let me first start by saying fewer than 25% of women actually know what their breast reconstructive options are before they have their breast surgery. The actual reconstructive options can impact what type of staging that you might do, whether it's immediate reconstruction or whether we delay it. Some of our breast reconstructive options include using the woman's own body tissues, which can include the abdomen, the buttock, the thighs, or even the back. And other options include implant reconstruction. How we decide one versus another can depend on the woman's body habitus, where their potential donor sites are, as well as what their medical comorbidities will allow them to have, and also what the woman's preferences are.
And I would guess most women would prefer if they can do something natural, from their own body to actually do that. What percentage of women are able to do that?
A fair number of women can have their own body tissue to be used. It is a bigger surgery, so often there's a little more of a recovery from using autologous tissue. And sometimes we're actually using a combination of implants and autologous tissue or your own tissue, depending on whether there is enough tissue to reconstruct the breast mound.
And I'm sure as a woman is getting ready for a mastectomy, she's thinking about a lot of things, but maybe not thinking, beyond to this point. But what are some things maybe they should be thinking about post-surgery?
Post-surgery in terms of recovery? Or
yes, and then going on to the reconstructive part.
Sure. So one of the big things that we can offer is immediate reconstruction. So it's almost sometimes thinking about what your reconstruction options are before you have your breast surgery so that we can time it. So sometimes, or many times, we're doing breast reconstructive surgery at the time of removal of the breast or the mastectomy. In that kind of setting, you can wake up with a breast mound intact, whether it's done with implants or tissue expanders or your own tissue.
And some women may feel hopeless during this time. How do you encourage them?
Well, I would really encourage women to really explore what their different options are. Breast cancer is a devastating and emotionally devastating diagnosis. There's usually a big team that can be associated with treating the breast cancer itself, but also with the reconstructive options. I would highly encourage them to talk to a board-certified plastic surgeon who specializes in breast so they can fully understand what their reconstructive options are before they have their breast surgery.
Well, thank you so much for joining us. Certainly a topic that affects so many women. Dr. Cho, thank you for joining us.
It's a pleasure to be here. Thank you.
All right, well, if you missed anything in this interview that you'd like to see again, we'll be posting it on our website later today at ABC13.com/info.